Most people in the Middle Ages did not die dramatically. They were not killed in battle. They were not executed. They were not remembered. They died quietly, often in their own homes, sometimes in fields, sometimes alone, and very often without anyone truly understanding why. To understand how ordinary people died in the Middle Ages, you must first understand one simple truth. Life itself was dangerous. From the moment a person was born, death was already close. Many never survived infancy. A child could be lost to fever within days, to infection within hours, to something as simple as contaminated water or spoiled milk. For those who survived childhood, danger never disappeared. It simply changed shape. There was no concept of safety as we know it today, no antibiotics, no understanding of bacteria, no reliable medicine. Pain was common, sickness was expected, death was familiar. One of the most common causes of death was infection. A small cut from a tool, a blister that broke, a thorn embedded in skin. Something that today would be ignored could become fatal. Wounds were rarely cleaned properly. Hands were dirty. Water was unsafe. Bandages were reused. Once infection began, there was little to stop it. Swelling, heat, pus, fever. If the infection spread to the blood, death followed quickly. People believed this was God's will, or punishment, or fate. They did not know it was bacteria. Fevers killed countless people. Not dramatic fevers, but slow, consuming ones. Typhoid, dysentery, malaria. Illnesses that thrived in unsanitary conditions. A person could go to bed feeling weak and never wake up. Sweat-soaked sheets, delirium, hallucinations. Family members watched helplessly. They prayed. They waited. They prepared for burial. Medical treatment was limited and often harmful. Bloodletting was common. Herbs were administered blindly. Relics were touched to skin. Doctors were rare. Barbers acted as surgeons. Knowledge was inherited, not tested. Another silent killer was hunger. Not always sudden starvation, but long, slow malnutrition. Poor harvests were common. Winter supplies ran out. Food became thinner, weaker. People ate less each day. Bodies weakened. Immune systems failed. Minor illnesses became fatal. Children were affected first, then the elderly, then the sick. Hunger did not kill loudly. It hollowed people out. Cold was just as deadly. Homes were poorly insulated. Clothing was thin. Firewood was limited. Hypothermia was not understood. People simply did not survive the night. Winter deaths were expected. Another common cause of death was childbirth. For women, pregnancy was always dangerous. No sterile conditions, no surgical intervention, no understanding of complications. Bleeding killed many women within hours. Infections followed shortly after. A woman could survive many births and then die suddenly during one. Children often lost their mothers young. Many men lost wives and remarried quickly, not from cruelty, but necessity. Without a woman, survival was harder. Accidents were constant. Falling from ladders, being crushed by animals, injuries from tools. A broken bone could end a life, not because the bone itself was fatal, but because infection followed. Internal injuries were untreatable. A fall could mean weeks of pain, then death. Work itself was dangerous. Fields, forests, workshops, no protective equipment, no safety standards. Exhaustion led to mistakes. Mistakes led to death. Disease spread easily. People lived close together. Animals lived indoors. Waste was everywhere. Plagues did not need to be massive to kill many. Even small outbreaks could wipe out families. People did not understand contagion. They believed illness traveled through air, smell, or divine judgment. Caregivers often became victims themselves. Religion shaped how death was perceived. Death was not unexpected. It was part of life. People prepared for it constantly. Prayers were said daily. Confession was essential. Dying without confession was terrifying. The fear was not of dying, but of what came after. Hell was vivid, eternal, unforgiving. People feared dying suddenly without spiritual preparation. This fear influenced daily behavior. A sudden death was seen as tragic, not because of loss, but because of the soul. Old age was rare. Those who reached it were considered blessed. But even then, death was not peaceful. Arthritis, blindness, chronic pain. There was no relief. Pain was endured, not treated. Mental illness existed, but wasn't understood. Depression, anxiety, trauma. People suffered silently. Some were labeled possessed. Others were ignored. Suicide occurred, but it was heavily condemned. Those who took their own lives were denied proper burial. Even in death, punishment continued. Violence was present, but not always the main cause of death. Raids, banditry, local conflicts. Ordinary people were collateral damage, caught in between powers they did not control. Yet even here, most deaths were indirect. Injuries, starvation after displacement, exposure. Death rarely came with meaning. Most people did not die heroically. They died tired, hungry, sick, often without understanding why. Families mourned briefly. Life had to continue. Fields needed tending. Animals needed feeding. Grief was real, but survival came first. Children learned early that death was normal. They saw siblings buried, parents die, neighbors disappear. Graves were simple. Markers were rare. Most people vanished without record. No names, no stories. Just lives lived quietly, then ended. From the modern world, this seems unbearable. But for medieval people, it was normal. Death was not an interruption. It was an expectation. And yet, people continued. They married. They had children. They laughed when they could. They hoped for good harvests, mild winters, healthy births. Life was fragile, but it was lived fully within its limits. Ordinary people in the Middle Ages did not die in legends. They died in reality. And that reality shaped everything about how they lived, not with optimism, not with security, but with endurance, day by day, until one day it ended.